Welcome students to Chapter 6, which is an overview of the skeletal system, not focusing so much on all the individual bones that make up our skeleton, but more generally kind of why we have bones, how we classify bones, the various structure of bones, both kind of macro and microscopically, and then some kind of skeletal physiology, how our bones develop, how they grow and are repaired, and so looking not kind of more at the individual bones, that's a separate chapter, but more at kind of an overview of the skeletal system, an introduction to the skeletal system, which is a system that you're going to probably encounter a lot because people often break their bones. I myself have broken bones in my foot and in my leg. So I've had quite a few bone fractures.
The 206 bones that make up the human skeleton are actually dynamic organs that give our bodies the structure and support necessary to stand, walk, and breathe. They cradle and support the body's softer organs, serve as the site for blood cell formation, and even complete a remarkable process of self-repair when injured, called bone remodeling. As a healthcare professional, it's very important for you to know bone anatomy and understand the critical process of bone remodeling, because many of your elderly patients will experience bone-related diseases such as osteoporosis. Osteoporosis affects the process of bone remodeling. The skeleton of a patient with osteoporosis may become so fragile that something as simple as stepping off a curb can cause a bone to break or fracture. This knowledge is critical so that you are able to discuss the prevention and treatment of osteoporosis with your patients. For instance, a common misperception among patients is that decreased bone density is a reason to avoid exercise. In fact, exercise, in addition to nutritional supplements, is a very important element in the treatment of osteoporosis. Patients who walk regularly and do lightweight strength training are actually able to increase their bone mass. By having a solid knowledge of the bone anatomy and the process of bone remodeling, you can educate your patients on the proper treatment of osteoporosis and other diseases affecting the bones.
So as the video suggests, you are going to come across a lot of bone injuries, or can come across a lot of bone injuries, even if you're not an orthopedic healthcare professional. Elderly patients suffer osteoporosis. There's a whole host of different diseases that affect the bone, so definitely a pretty important chapter. Before we get to bones and skeletal tissue, we have to step back and talk about cartilaginous tissue. So when most people think about the skeleton, they think the bones. But other parts of the skeleton include all our joints, and in all of our joints is a lot of various skeletal cartilages. So these are our three cartilaginous connective tissues. We have kind of hyaline cartilage, which has a smooth, kind of glassy extracellular matrix, elastic cartilage, which is full of kind of stretchy, springy, elastic fibers, so it's very flexible, and then fibrocartilage, which has big, thick collagen fibers in it, so it's a very strong, kind of tough cartilage. All three cartilaginous tissues are very resilient. They are full of a lot of water. Water is one of our survival needs. That water lends a lot of resiliency to the skeletal cartilages. They are able to kind of take abuse pretty well. That's actually a really good thing that they're really resilient, because they don't have any blood vessels, and without blood vessels, they don't repair so well. So when you damage your cartilaginous tissues, it's tough to get those to repair because they don't have any blood vessels. They also don't have any nerves either. So typically cartilaginous tissue doesn't give off a lot of pain signals. Because they lack blood vessels, all of the cartilaginous tissues are surrounded by connective tissue, what we call girdle. Essentially it's kind of a capsule that surrounds the cartilaginous tissues called the perichondrium. This is where they get their oxygen and nutrients, because the connective tissue will have blood vessels in it. It also allows the cartilaginous tissues to kind of stay firm in their size and resist kind of expansion. It's one of those things that makes them really good at kind of taking abuse. And so we find our cartilaginous tissues in areas where we need that resiliency. So the most abundant of the skeletal cartilages is hyaline cartilage. It makes up the costal cartilages around our ribs that attach our ribs to our breastbone or sternum. It is the rings that keep the trachea open so that our airway always stays open. It composes the laryngeal cartilages for a lot of our voice apparatus. We find it lining our kind of airways inside the lungs as well, because it has this kind of glassy, kind of smooth extracellular matrix. It's perfect for articular cartilage, so that we have a kind of frictionless, or at least a certainly reduced friction surface for when our bones kind of rub together in our joints. It is also the cartilage of our nose, so our nasal cartilage. The least abundant of the cartilaginous tissues is the elastic cartilage, again because it's got elastic fibers, nice stringy, stretchy rubber bands. It is much springier than the hyaline cartilage. We only find it in two places in the body. That's our outer ear, and then also the epiglottis, which is this little flap of tissue that closes over our airways when we swallow, so that food does not go down the airways. The toughest of the cartilaginous tissues is the fibrocartilage. Because it's got big, thick collagen fibers with lots of good tensile strength, we find fibrocartilages where our body takes a lot of abuse. So things like the menisci of our knees, the pubic symphysis, and the intervertebral discs. Because these are parts of the body where a lot of the weight of the body rests, that big, thick collagen fiber, fibrous connective cartilage is really important. Cartilages grow in one of two ways, what we call appositional growth and what we call interstitial growth. Appositional growth is a unidirectional growth. Appositional means alongside of. So the cartilaginous cells, kind of against the sides of the perichondrium, will go through mitosis and make lots of copies of themselves, and so the cartilage tends to grow in just a single direction as new cartilage cells are kind of added on top of the old ones. Interstitial growth intermeans between, so here the cartilage cells kind of on the internal part of the cartilage go through mitosis and make lots of copies of themselves, and the cartilage grows in multi-directions, kind of expanding outward, almost like blowing up a balloon. Now, cartilage, as it ages, becomes calcified. It starts to incorporate calcium crystals into its extracellular matrix. But a calcified cartilage is not osseous tissue. Cartilage's calcifying is a normal part of bone development. It's a normal part of kind of aging of our cartilages, but calcified cartilage is, even though it's hard, like bone, it is still not bony tissue. Go back here for a second. So I mentioned the costal cartilages earlier. As we age, these costal cartilages become calcified. That allows less expansion of the thorax, less expansion of the lungs inside the thorax, and it actually contributes to the fact that it is harder for an older person to breathe than it is for a younger person, just because the costal cartilages have calcified to some degree. And the calcified cartilage is harder than the nice kind of resilient, flexible cartilage. So there are 206 bones in the body that have names, as the video mentioned. Now there are a couple of little bones that don't have any names. A couple of them in and around the thumb area and in the skull. But 206 bones in the body that have a name. We break those bones into two sections, what we call the axial skeleton and what we call the appendicular skeleton. The axial skeleton are the bones of the body that go with the long axis of the body, hence axial skeleton. So we're talking about the bones of the skull, the bones of the vertebral column, and the bones of the thoracic or rib cage. The appendicular skeleton consists of the bones of the upper and lower limbs, as well as the girdles that attach those bones to the axial skeleton. So for the lower limb, that's the bones of the pelvic girdle, and for the upper limb, that is the bones of the pectoral girdle. So this is kind of one of those places where you can start to kind of divvy up the skeleton so that you're not trying to kind of learn it all at once. This is a nice kind of clear demarcation point. Focus on just the axial skeleton and focus on the appendicular skeleton. When we look at bones, one of the first things that we will do is look at the shape of those bones. It's one of the ways that we classify the bones of the body. There are 4 shapes: long, short, flat, and irregular. So the long bones, which is most of the bones of the appendicular skeleton, are longer than they are wide. The short bones are roughly the same length and width, so they're somewhat more cuboidal. Now, flat bones are kind of a thin sheet of bone, and they may not necessarily be completely flat because they can also be curved. So all of the bones of the skull up here are flat bones, but they're kind of a sheet of bone. And then any other bone that doesn't kind of fit neatly into one of those other categories, longer than it is wide, roughly the same length of width, and a kind of sheet of bone. If it doesn't fit neatly into one of those 3 categories, then it is classified as an irregular bone, like the vertebra here, or perhaps the auditory ossicles inside your middle ear, which have really funky shapes. We do also have a very specific type of short bone called a sesamoid bone. These are bones, short bones that are found within joints. The patella is a great example of a short sesamoid bone. In terms of what do our bones do for us, some of it is super obvious. Support, protection, movement. They support our body and they support our soft organs. They are great protection for a lot of our vital organs. So we have them around the brain, around the spinal cord, around the heart and lungs. All right, you've got the skull around the brain. You've got the vertebrae around the spinal cord, and you've got the ribs and thoracic cage around the heart and lungs. Those are all really vital organs: brain, spinal cord, heart, and lungs. And so they are deserving of a lot of that nice hard protection of our bony tissue. Our skeleton and our bones are also our levers. Our muscles have to be able to pull against something. They have to be able to move something in order for us to move, to walk, to talk. They can't just pull on soft tissue. They need a nice hard lever upon which to pull. That lever is our skeleton. So those are kind of the obvious functions of our bones, but there are things that our skeleton does for us that are less obvious to most people. We store minerals in our skeleton, particularly calcium and phosphorus. We also store some growth factors that help us develop properly. We also do something, or our bones also do something that is super important for our body that almost nobody ever thinks of. It's called hematopoiesis. He means blood, esis means generation of, and so we're talking about the formation of our blood cells. Our red blood cells that carry oxygen, our white blood cells that carry out immune functions, the platelets that clot so that we stop bleeding. All of those are made in the red marrow within our skeletons, hematopoiesis. We also store triglycerides and other fats in the yellow marrow inside our skeleton. And then lastly, even though the bones are considered part of the skeletal system, not the endocrine system, they do produce a couple of different hormones, such as osteocalcin, that are related to kind of the formation of our skeleton. The hormones that are produced by the skeletal system don't really have like big systemic effects. They're really just focusing on the skeleton itself. So as that video mentioned, our bones are considered organs. Yes, of course, our bones are composed of osseous tissue, but they also have nervous tissue in the form of our nerves. They have cartilaginous tissue, such as the articular cartilage. They have fibrous connective tissues, such as our tendons and our ligaments that are part of our bones. And then there are blood vessels within our bones, and so in our blood vessels we find smooth muscle and simple squamous epithelial tissue. So even though when we think of our skeleton, we really think just the bones, and really what we think of bones is the osseous tissue, which is by far, of course, far and away the bulk of it. It is not just a single tissue type. There are multiple tissue types found in our bones, and so they are considered organs, multiple tissue types. Typically, we will look at 3 levels in terms of anatomy of our bones: gross anatomy, microscopic anatomy, and then we look at kind of chemical anatomy. What kind of molecules and what types of molecules do we find in our bones? But we're going to save those kind of 3 levels of anatomy for a separate lecture.